It is estimated that around 20% of Australian children are living in a household where a parent experiences mental illness. These children are at a greater risk than their peers of developing mental health issues during their childhood or later in life. It is not the parent's illness alone which can potentially impact on children, but a combination of factors such as psychosocial stresses on the child, stigma, stress from a possible carer role, genetic inheritance, family relationships, and the availability of other supportive adults. The risk to these children can be reduced. Mental health workers can help prevent mental health issues in these children by acknowledging the parenting role of their patients, by adopting a family focus when treating parents, and by taking into account the potential impacts of parental mental illness on the children in these families. The Children of Parents with a Mental Illness, or COPMI, national initiative promotes better mental health outcomes for these children by providing information and resources for both family members and workers, sharing key evidence and evaluation strategies in this field, promoting support programs, and producing workforce development resources for mental health workers. Produced by the Australian Infant, Child, Adolescent and Family Mental Health Association Limited, COPMI, with funding from the Australian Government Department of Health and Ageing, utilising extensive consultation with professionals, consumers and carers, and in line with the National Mental Health Workforce Standards, the Keeping Families and Children in Mind online education resource has been developed by COPMI to assist mental health workers and other allied workers to use a family focus when working with parents who experience a mental illness. The Keeping Families and Children in Mind online education resource is engaging and interactive, delivers up-to-date evidence-based content and information, presents the lived experience of children and parents from families where a parent experiences mental illness, presents the views of leading fellow professionals in the field, features 2 fictional, realistic families for workers to try out new approaches. Designed for both solo use and for use within a group training setting, this education resource focuses on practical and achievable ways to incorporate a family focus into work practice within most workplace settings.
Your clients want to be parents and they want to be the best possible parents they can be. As a clinician, you tap into something that's vital to the adults you're seeing when you tap into them around their parenting role.
GPs deal with families and they're the first point of call, and that's why this resource would be particularly beneficial for GPs because it would enhance their skills in dealing with these issues because they deal with them all the time.
I would hope that adult mental health workers in particular can see that any opportunity they take up in whatever small little way might exist for them to do this is one of the most powerfully preventative bits of work they can do.
The Keeping Families and Children in Mind online education resource is free. Just go to www.copmi.net.au and follow the links to register for your training. You can also find out about group training sessions in your region. This resource has been designed for mental health workers, including mental health nurses, psychiatrists, psychologists, social workers, occupational therapists, GPs, and other allied workers. It could also be a valuable resource for a range of educators and for others in the community who work with families where a parent experiences mental health problems.
It's not just the person with the illness, it's the whole family that's affected by it, and just circling, just choosing that person that has an illness and talking to them about it isn't really going to help.
It's like I sort of gave up on myself, but I never gave up on my child because I thought it's not her fault. She's the only thing that keeps me living every day.